Hello. I thought it would be a good time to talk a little bit about the coronavirus outbreak. And before I say anything else, it's really important that I remind everybody that I am not a health professional. What I'm wearing here is a surgical mask. They were made for surgeons who would be operating on patients, and as such, they want to protect the patients, the open wounds, from bacteria coming from the surgeon's mouth. And also if they were to cough or to sneeze or sweat, then it doesn't drip inside the wound. It doesn't really work the other way around. The surgical mask is not going to protect you from getting a virus. Vira is really small, and it will be able to penetrate a mask like this in many cases. In other cases, it can simply go over or from the side, and nobody has really said that anyone healthy should be wearing this. This is for the sick. If you're sick and you're wearing a mask like this one and you cough, then it gets caught inside the mask, and then you can protect your surrounding environment. So that's a little bit about masks. Okay, well, I've been in Hong Kong now for a good 45 days. I've been here throughout the heat of the virus outbreak. This virus which we're dealing with is a coronavirus. We see that people, they get the cold, the common cold, every year. This is caused by rhinovirus and coronaviruses. I think rhinoviruses are responsible for about 40% of common colds globally, as coronaviruses are responsible for roughly 20% of the common colds. And we've known about the coronavirus since the 60s, in humans at least. So it's really not a big deal. The novel coronavirus, the new coronavirus, COVID-19, is more aggressive than some of the other coronaviruses that we have. And it's estimated that it might take 5 to 10 times as many lives as the common flu that we see every year during the flu season. So that's why this is a little bit more severe. Having said that, it's important to remember that it is not like the 1918 Spanish flu, which we saw at the end of World War I, where everyone was weak and there were very low resources, and vitamins, vegetables and fruit were not available, and probably 50 million people, even more, they lost their lives. Now what happened in 1918 was that, which was a H1N1 virus, it activated people's immune defense. So the stronger your immune defense was, the more likely you were to die. A lot of young people, a lot of really young people, children, or the elderly, sick people, they were more or less unharmed by the 1918 Spanish flu epidemic. Whereas we know who we need to protect now. It's been so long that we know exactly who to protect with the COVID-19 virus. We need to protect the elderly, we need to protect our healthcare workers, and we need to protect people with comorbidity. Comorbidity is if you have a pre-existing condition. So maybe you have asthma, maybe you are diabetic, maybe you are obese, maybe you smoke a lot. A lot of these people, they will be at a health risk with the COVID-19. But normal, young, healthy people are really unlikely to be harmed in any way. It's super important to remember that most people do not have this virus. Most people are not infected. Most people you see on the buses, when you're standing in queue, most people you see at work, they are not infected by the virus. And from the very few people that do get infected, you will see that the likelihood that they get harmed by the virus is incredibly low. It is really just a few people within society. It is the elderly, it is healthcare workers, and it's people with comorbidity that we need to protect and look out for. So what can you do to protect yourself? Well, generally you can try to stay healthy, you can eat well, you can sleep well, get the sleep that you need, drink plenty of water, exercise, continue to wash your hands with soap, and you can use hand sanitizers, which is alcohol based. That's good as well. If you need to cough, then don't cough into people's faces or sneeze into people's faces. You'll be spreading all the germs. Try to cough into your sleeve or into your arm or into a tissue, and then throw the tissue away. That's the best way to go about it. Do not panic. Panic is just kind of dumb, but do be a little bit concerned. I think the way to look at this virus, and this is my personal opinion, but I based this on a lot of interviews I've watched, a lot of podcasts, a lot of reading. I think that you personally are likely to be fine. You're likely to be absolutely unharmed by this. So, hooray. However, this is going to hit enough people that you are likely to have someone within your circles that is going to be harmed by this. Someone who's going to be severely sick, or maybe even someone who's going to die from this. And that's probably just reality of this pandemic, which we're looking at now. So stay healthy, do your part to protect the vulnerable people in society. And if you want to know more, then seek out information at WHO, seek out information, the Red Cross, maybe the CDC. Don't panic.